Hi everyone, I'm Catherine Navarro, the current ACCE president. I want to talk to you a little bit today about what the CCE certification has meant to me. So personally, taking the CCE exam and passing it, becoming certified, was really a huge weight off my shoulders once I found out that I had passed it. It also gave me a great sense of pride personally. I studied for a year to prepare, and it was probably the most challenging certification exam I've ever taken. So to pass it felt like all my efforts were really worth it, and I truly deserve the title of CCE. Professionally, again, it was a momentous achievement in my professional career as well. It did seem to solidify to myself as well as to my colleagues that I do have the knowledge, experience, and communication skills to excel at my career. My employer also recognized my achievement and provided me with a pay increase for that certification, which was much appreciated, as you might understand. The CCE also, it provides value to our clinical engineering profession. It provides validation that as a clinical engineer, you know how to manage many different situations encountered in the general clinical engineering role, and that you can communicate effectively with both your customers and your leadership. Since the exam is somewhat challenging, even for those who've been in the field for a while, it does make earning the CCE credentials even more valuable to our profession. And I would encourage everyone who's qualified to take the CCE exam and to become certified. It is an excellent certification to demonstrate that you're not only qualified to be a clinical engineer, but that you can excel in that role. It's also recognized by many employers, and some may provide additional incentive, like mine did, to achieve that certification. And some employers may actually require certification to advance in your career, so that's something to take note of. But in addition to the professional reasons to pursue the CCE certification, it's also just good to pursue it for yourself because it gives you, again, that great sense of pride to set a goal, to prepare for it, and then to achieve it. So I hope everyone out there is getting excited about the CCE certification and going to be taking it when they qualify. Thanks.
Hi, I'm Michele Manzoli, and I'm a certified clinical engineer. Getting the CCE has meant a lot to me, not just because of the exam, but because of what it represents. It's a recognition of the knowledge, judgment, and responsibility that clinical engineers bring to healthcare every single day. It has also strengthened how I work with hospital leaders, clinicians, and vendors. It helps communicate that this is a specialized field, one that requires technical expertise, system thinking, regulatory knowledge, and a real commitment to patient safety. What I value most is that it creates a standard of excellence. It pushes you to keep learning and stay current in a field that never stops evolving. If you are a clinical engineer who hasn't pursued the CCE yet, I encourage you to consider it. It's an investment in yourself and in this profession. It challenges you to reflect, identify where you can grow, and show your commitment to high standards. And it can open real doors professionally too. During HTM week, let's take a moment to recognize what clinical engineers make possible every day. And if you are ready to take that next step for yourself and for this profession, pursue the CCE. It's worth it.
Hi, everyone. I'm Hank Stankwitz. The ACC asked me to tell you folks why I thought it was important to become certified as a clinical engineer. And there's two reasons. One, it provided me with the credibility, if you will, that I was a capable clinical engineer. I know many of us have, already have a college degree, but I think the ACC CEE adds another level of credibility to our profession and to my individual growth. When I took the exam, it was in 2011 after working for 30 plus years, so it was quite a challenge for me. By then, I was working at kind of in a headquarter role, not doing hands-on biomed, and I wanted to prove to myself and my colleagues that I was still a capable clinical engineer, that I could still do hands-on frontline work, if you will. And that really gave me the credibility and the knowledge for myself that I was still capable of performing work as an on-site clinical engineer. The other reason that I think it's important to get certified is for our profession, for the growth of our profession. We work in a healthcare setting with physicians, nurses, respiratory therapists, physical therapists, lab professionals. They all have those initials after their names. We're in a work environment where those initials become our credibility. And in clinical engineering, it's important we establish that credibility. And it's not just enough to say you went to college. You want to show them that you're ongoing, keeping up your competencies, and that you and your department are professionals just like the nurses and the lab techs, etc. So I think it's very important that you do that for the bigger field, so that when folks are dealing with us, they realize they're dealing with other professionals. So again, the two reasons: one, it gave me a great personal growth. I was concerned that I was losing contact with the field after 30 plus years of working, and it encouraged me to relearn some of the things that I had forgotten. And the second thing is, it really helped establish our credibility as a profession within the organization. The hospital, the VA I worked with, really made a big deal about many of us getting certified, and applauded our efforts. And it was great to have that recognition of not just for myself, but for our whole field. So I do encourage you to get certified, and keep up with the renewals, keep up with your competencies. Both as an employee and an employer, it's important for your own growth and your own future. So good luck, and take care.